I'm Dr. 𝗂𝗶𝗵𝗂𝗵𝘁𝘀𝗵𝗵. I'm a consultant rheumatologist at Aster CMI Hospital in Bangalore. Let's learn about rheumatoid arthritis. So what is rheumatoid arthritis? It is the commonest type of inflammatory arthritis. It is an autoimmune condition, meaning your immune system mistakenly starts affecting the normal joints of the body. In rheumatoid, apart from joints, patients can also have involvement of the eyes and other organs like the lungs, the heart, and sometimes the nervous system as well. What are the common symptoms of rheumatoid arthritis? So patients with rheumatoid arthritis usually present with pain, stiffness, and swelling affecting the small joints of the hands. So patients can have involvement of the fingers, the wrists, sometimes the ankles and the toes. Sometimes they may also have involvement of the large joints like the shoulders and the knees as well. So they have typically early morning stiffness which lasts more than 45 minutes to 1 hour. When the symptoms are severe, patients can also experience feverishness, fatigue, and weight loss as well. So who is affected commonly by rheumatoid arthritis? Rheumatoid arthritis tends to affect women much more than men. So it is about 3 times more common in women. And it usually affects women in the age group of 30 to 60 years. But of course, young children and elderly can also get affected by rheumatoid arthritis. Now, how do we make a diagnosis of rheumatoid arthritis? So diagnosis is commonly made by rheumatologists by taking an appropriate history, doing an appropriate clinical examination, and we also order some blood tests like rheumatoid factor and anti-CCP antibody in order to confirm the diagnosis. Now, once the diagnosis is confirmed, we may sometimes want to do some x-rays to look for any early damage like erosions which can be seen on the x-rays. Now, coming to the treatment. The mainstay of treatment for rheumatoid arthritis is by medications called disease-modifying anti-rheumatic drugs. So these are long-term treatments and have to be administered by a trained professional, which would be a rheumatologist. And the patients also have to come frequently for monitoring purposes, not to just monitor the disease, but also to make sure that the medications are being taken safely. Apart from these DMARDs, we also give symptomatic control with medications like simple painkillers, analgesics. Sometimes we may also administer steroids in small doses in the oral form or sometimes into the joints, that is intra-articular injections. These days, we have much newer and much more effective medications which are called as biologic medications, which are given in oral form or intravenous forms as well. And these have really revolutionized the treatment of rheumatoid arthritis. So patients no longer we see with chronic deformities that we used to see many years ago. Patients lead a normal life, and apart from taking medications, if they also adapt a healthy lifestyle, maintain a good weight, not becoming overweight, do simple stretching exercises like yoga, tai chi, pilates, for example. People actually lead a normal life these days with rheumatoid arthritis. They have a normal social life, they have a family life. Even fertility is not affected by rheumatoid arthritis. So if you have symptoms of rheumatoid arthritis, please go and meet a rheumatologist early. So we at Aster CMI have rheumatology department which is full-fledged, managing multiple rheumatological conditions including rheumatoid arthritis and several other inflammatory arthritis, connective tissue diseases like lupus, systemic sclerosis, vasculitis, etc. Thank you.